Ebola is often seen as a frightening and highly dangerous disease, but understanding the facts is key to reducing fear and improving safety. In this video, we'll explain what Ebola is, how it spreads, and what you need to know to stay informed. Ebola is a rare but severe viral disease that affects humans. It is caused by a group of viruses known as the Ebola virus family. The disease was first identified in 1976 and has mainly been associated with outbreaks in parts of Central and West Africa. Ebola can lead to serious illness and, in some cases, can be life-threatening, particularly where medical care is limited. Unlike illnesses such as flu or COVID-19, Ebola is not airborne. It spreads through direct contact with bodily fluids from an infected person. This includes blood, vomit, urine, saliva, sweat, and other fluids. The virus can also spread through contact with surfaces or objects contaminated with these fluids, such as clothing, bedding, or medical equipment. Because transmission requires close physical contact, the risk is generally limited to people in direct contact with infected individuals. Symptoms of Ebola do not appear immediately. They can develop anywhere from a few days up to a couple of weeks after exposure. Early symptoms often resemble flu and may include fever, fatigue, headache, and muscle pain. As the disease progresses, symptoms can become more severe, including vomiting, diarrhea, and in serious cases, internal or external bleeding. Without proper care, the illness can worsen rapidly. For people in the UK and most developed countries, the risk of Ebola is extremely low. Cases are usually linked to travel or direct exposure in outbreak regions. The virus is not spread through casual contact, making everyday risk minimal. However, healthcare workers and those caring for infected individuals are at higher risk without proper protection. Preventing Ebola relies on strong infection control measures. This includes avoiding contact with bodily fluids, practicing good hygiene, and using personal protective equipment where required. In healthcare settings, strict protocols around isolation, containment, and protective equipment are essential to prevent spread. Ebola is a serious disease, but it is also well understood and controllable with the right measures. Understanding the facts helps reduce fear, prevent misinformation, and support safe working environments. Dynamo Training Solutions, real training, real skills, real impact. Stay informed, stay prepared, and take your training to the next level with Dynamo Training Solutions. Real training, real skills, real impact.